Hi, my name is Naira Ray. I'm a physician assistant that works with Christian Athanasius at Santa Rosa Orthopaedics. We're going to talk a little bit about anterior cervical discectomies and fusions today. Dr. Athanasius has decided that you are a good candidate for an anterior cervical discectomy and fusion. We'll talk about the day of surgery, the surgery, and what you can expect a little bit afterward. So the morning of surgery, you'll arrive to the hospital. You'll go to the preoperative area. The nurses will get you ready. You'll get an IV. The anesthesiologist will come and talk to you. The operating room nurse will come and talk to you. And then Dr. Athanasius will come and talk to you. Everybody's going to ask you the same questions over and over again, your allergies, the procedure, etc. When Dr. Athanasius sees you and asks you the name of the procedure, he'll mark on your neck. You go to the operating room once it's all clean and ready for you. The room is very bright. It's cold. There's a lot of people in there. It can feel a little bit overwhelming. You'll go to sleep and get a stiff tube down your throat. We monitor your nerves throughout your body and also in your throat. It's a little bit stiffer tube than normal, so you may have a sore throat and some difficulty swallowing afterward. After these surgeries, it's not unusual for people to have some difficulty swallowing. That will resolve with time, but you need to know that that's part of this process. We monitor your nerves throughout your body during the surgery. We use x-ray the entire time, and we use a microscope as well. Dr. Athanasius will make an incision in your neck on the right side from sort of the center to this muscle right here and establish which level we're operating on. At that point, he'll take the disc out at that level, put a small spacer cage at that level, and then a plate goes on the front with screws at each level. You will bring the brace that we've dispensed in your pre-op appointment to the hospital. I'll put that on you before you wake up. You're gonna wake up in the collar with a drain. You'll spend one night in the hospital. While you're in the hospital, physical therapy will work with you, occupational therapy will work with you. You'll get more antibiotics, and you'll be discharged as soon as you meet 3 criteria. You need to be able to urinate on your own, you need to be able to walk, and we need to establish how much oral pain medicine you'll need when you're at home. You'll probably go home late the next morning or early the next afternoon. We'll see you in the office 2 weeks after that. You will receive post-op instructions from our office. You will shower on day 5. You will change the dressing at that point. The dressing will get pulled off. You can shower onto the incision and pat it dry with something clean like a paper towel and replace the dressing. The dressing needs to stay, the incision, needs to stay covered and clean until we see you in the office at the 2-week mark for more x-rays. The risks of this surgery, you'll sign the consent in the office and it's more complete there. You may have some difficulty swallowing. We would expect that. You will have a sore throat, I can guarantee that. People get pain through their neck up here and their shoulders. Ice packs are really helpful for that. The risks of the surgery, when Dr. Athanasius gets to the front of the spine, he has to move some important structures like your trachea and your esophagus this way, and your carotid artery and jugular vein that way to get down to the front of your spine. There have been times, not with us, but in other surgeries with other surgeons, there have been times where there are bleeding issues. We've, thank God, never had that. There can be irritation to the esophagus. That's why there's some swallowing difficulty occasionally after surgery, not very often. I think that's it. Any questions?
No, when do I start?